How much protein should I eat while taking tirzepatide? Let's talk about the evidence-based guidance that can help you preserve muscle while losing weight. Before we dive in, quick reminder, this is educational information, not medical advice. Always talk to your healthcare provider or a registered dietitian for personalized recommendations based on your specific health needs. If you're taking tirzepatide, you might be wondering how much protein you actually need. The answer, probably more than you think. Research suggests most adults taking tirzepatide should aim for 1.2 to 1.6 grams of protein per kilogram of ideal body weight daily. That's significantly higher than standard dietary recommendations, and getting it right really matters for your results. Let me break down what that actually means. If your ideal body weight is around 150 pounds, that's roughly 82 to 109 grams of protein each day. Your healthcare provider can help you calculate your specific target based on your ideal body weight and individual needs. So why does tirzepatide make protein so important? This medication is FDA approved as Mounjaro for type 2 diabetes and Zepbound for weight management. It works by mimicking hormones in your body that regulate blood sugar and appetite. It acts on appetite centers in your brain and slows how quickly food leaves your stomach, creating that feeling of fullness that helps with weight loss. But here's the challenge. That same appetite suppression can make it really hard to eat enough protein right when your body needs it most. When you're losing weight, your body doesn't just burn fat. It can also break down muscle tissue for energy. Adequate protein helps protect that lean muscle mass. And muscle is metabolically active, meaning it burns calories even at rest. Preserving it helps maintain your metabolic rate, which supports long-term weight management. Now let's talk about actually getting that protein in when you're not feeling hungry. Distribution matters. Instead of trying to eat a huge amount in one sitting, spread it across multiple meals. Aim for 20 to 30 grams per meal. Many people find their appetite is better earlier in the day, so prioritize protein at breakfast and lunch when possible. Choose protein sources that are easier to tolerate. Some patients find dense, heavy proteins like red meat harder to manage. Lighter options might work better. Think fish, chicken breast, eggs, Greek yogurt, or cottage cheese. Protein shakes or smoothies can be helpful because liquids may be easier to consume when solid food feels too heavy. Just make sure you're still getting adequate nutrition from whole foods too. Consider the texture and preparation. Moist, tender proteins are often easier to tolerate than dry or tough ones. Soups, stews, and slow-cooked dishes can be good options. If you're struggling with nausea, cold proteins like yogurt or protein smoothies might sit better than hot meals. Here's a simple strategy. Eat protein first. When your appetite is limited, prioritize protein at the beginning of your meal before you feel too full. This helps ensure you're meeting your needs even if you can't finish everything on your plate. Now, there's an important exception to these protein recommendations. If you have chronic kidney disease, stage 3 or higher, you should follow different guidelines. The American Diabetes Association recommends approximately 0.8 grams per kilogram per day for people with kidney disease, unless your nephrologist directs otherwise. This is really important, so make sure your healthcare provider knows your complete medical history. What about side effects? The most common challenges are difficulty tolerating dense or fatty proteins and nausea that makes eating feel unappealing. If you're experiencing persistent nausea that prevents you from meeting your nutritional needs, talk to your doctor as prescribed. They may adjust your approach or suggest strategies to manage symptoms. If you're having trouble swallowing, severe abdominal pain, or persistent vomiting, contact your healthcare provider right away. Some patients worry about protein supplements. They can be a useful tool, but they shouldn't completely replace whole food sources. Whole foods provide other important nutrients like vitamins, minerals, and fiber. If you're considering supplements, discuss it with your healthcare provider to make sure they fit into your overall nutrition plan. Here's what to remember. Most adults taking tirzepatide need 1.2 to 1.6 grams of protein per kilogram of ideal body weight daily. Spread it across multiple meals. Prioritize it early in the day and choose sources that are easier to tolerate. If you have kidney disease, follow your doctor's specific recommendations and always consult your healthcare provider about your individual nutritional needs and any challenges you're experiencing. Meeting your protein goals while managing reduced appetite takes planning, but it's essential for preserving muscle mass and supporting your long-term health. Your healthcare provider can help you develop a personalized nutrition strategy that works with your treatment. What strategies have helped you get enough protein? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.